This is the bite registration of an all-on-X implant case, the full mouth reconstruction. So you can see that once we get the final impression, the cast will be made. So the bite registrations that we have done previously, this is the lower cast with the final implant positions and the soft tissue recording, and the details have been made on this. So I always the mount is cast, even though the digital dentistry is helping us to get the maximum out of it, but we always have to go through these manual handling of these case with the bite registration. So I can explain to you that thing after the steps that we're going to do, why we have to have this manual handling of these cases between the digital involvement of the case management. Once we get the bite registration, so the next step has to be, we'll be pouring the cast and making the final impressions, and then we have to mount that thing on an articulator until we finish the case, because this articulator will always keep a record of the vertical dimensions. At the same time, we'll be able to do some changes according to the clinician's need, and all the other aesthetic parameters of the patients, what we need and what the patient needs, will be recorded in this bite. So this bite will come as the wax bite as our reference. At the same time, sometimes if it is a partially edentulous case, that we can go for the teeth the way that we used to do in the conventional methods. At the same time that you can get the parameters from the patient, if the patient is wearing a proper preliminary prosthesis has been introduced to the patient just after the implant placement surgery. In this case, because this is an intermediate bite registrations of the patient just before going for the permanent restorations after the 6 months of the implant healing. So in that case, I want to make sure that the patient's vertical dimensions and what patients needs with the aesthetics and the labial fullness and the comfort, everything has to be considered in this case when I was recording the patient's bite registration. We can go ahead and mount this case on an articulator. So as a clinician, we'll be having an idea how the patient's teeth will be set and the occlusions will be arranged. Especially there are so many parameters where the implants will be on the ridge and the teeth will be set on that. So it can be done with the manual mounting. At the same time, so there's another use of this bite registration with a wax bite, that we can go planning into the digital dentistry. That one is a method that I'll be using on my cases. Still, I would like to go ahead and mount the case on an adjustable or semi-adjustable articulator, because that we are going to move into the digital dentistry from the traditional dentistry, because we have the confidence in that, because we have been doing and using that with our patients. Because when you're having, for these all-on-X cases, the full mouth reconstruction cases are very serious cases, because these are complicated cases that will be transforming the patient's natural dentition, natural jaw relationships into the fully prosthetic implant mounted discipline. So in that case, always to have some parallel lines, that the manual, the record keeping, the manual impression taking, and the same time the digital dental recordings of data of the patient's mouth and the bite registration. First, this case we'll be using to mount the case, mount the bite with the final cast on an articulator. This is a semi-adjustable articulator. It has the acorn articulator. It has the moving condyles. So it'll be helpful for us to do the simulation of the jaw relationships and the jaw movements. Okay, let's go ahead and mount the cast in this articulator. Okay, this is the first step of the virtual bite transition. So somebody who can understand this is the digital bite registration. There's no such a thing called digital bite registrations. Bite registration has always to be done manually, and chair side with the patient. The clinician should make the bite block sealed inside the mouth to record the dimensions, anteroposterior and the vertical. Once you made that, there are several ways of getting the bite registrations of the patients. But in this case, the complete edentulous case with All-on-X implant placement, you have to go for the full mouth bite registration. Once you get the bite registration, once you get the final impressions, and bite registrations and the cast will be mounted in an articulator, so we can get this data to the computer for us to proceed with the virtual bite transition. So from that step that we can get into the permanent prosthesis design and to communicate with the laboratory technicians for us to mill the final prosthesis according to the desired features what the clinician needs. So the first step of this procedure will be starting to scan the upper and lower arches of the patient. So in that case, all the things are fixed. Open up the articulator. So we'll be scanning. So you can remove the incisal rod of the articulator. We'll be scanning the upper impression this way. I pay more attention for the labial surface of the cast to collect the data. After collecting the data of the implant bed. So you will understand why I was concerned about collecting the data of the upper cast in the anterior or the labial region. So I hope that we've got details, proper details. I can go ahead and check whether you got the proper data of the upper arch for us to proceed with the virtual bite registration. Now we'll move on to the lower cast. We'll be starting to record the impression surface of the implant bed. One thing is very important, that when you're going to record the lower cast and the upper cast with the impression, in your casting you need to get this soft tissue material should be arranged cast for us to collect, for the scanner to be sensitive to collect the whole data. This is the most important part that we'll be needing to go for the digital dentistry involvement of these particular cases of the full mouth reconstruction. As you can see, this is a bite, the upper and lower bite rims are sealed. So you can see the midline, you can see the occlusal plane, you can see these the canines. So this bite block can be separately scanned. Once you do the separate scanning, so you have a job, some of the softwares that when you're doing the digital dentistry of making the prostheses, the bite block can be orientated on the impression, the cost, or this working cost that you have scanned and transferred into the software. On the other hand, some of the softwares will be recognizing that this bite registration will be kept on the models and it will be closed in this desired position, and then you'll be scanning that as a normal the bite registration that we do a dentate patients when they are keeping their teeth in contact. So in that case that we check for the errors and the modifications and the requirement of the data that we have done in the upper and lower, then we can go for the next, the bite registration collection of data. So when you're doing that, what we'll be doing is we'll keep the articulator in place. When the bite blocks are mounted, then we can start recording the data of this. Always make sure that you'll be gathering the data of the upper and lower jaw bite blocks are in place the way you mounted on the articulator. This is very important for several steps that you'll have to come across when the technicians or yourself are going to design the final prosthesis. This frosty data collection will be collecting the data from 3 different geological sites. What are those sites? One is the upper cast, the surface of the upper cast. Second one is the wax bite rims, the fused one. And the other one is the lower study cast. The time that we are designing the prosthesis, you will realize how much of this data collection is necessary for us to proceed with the next step of the virtual bite transition. You see how the data is collected. And you see the computer is reading the data gathered from the upper cast, the lower cast, and the wax bite. This is the most important procedure if you want to do this transition, bite transition, digitally or with the help of the computer. Take your time and collect the data. It's very important to collect the data, all the characters that you have, characteristics rather, marked, engraved on the wax bite rims at the chair side. You see that? How the occlusal plane is recorded, how the high lip line is recorded. There you go. You can mount the incisal rod to the articulator and secure it for your future need. And you see how the data has been processed after you scanned and collected from the articulator and the bite blocks directly from the intraoral scanner. This is the data, this is the time that the clinician can transfer the manual data which was gathered or collected from the patients at the chair side into the computer. Hereafter, some of the steps will be done and which will make the life easy for us to do the designing part, for us to give proper the final prosthesis for the patients the way he needs it. At the same time, in this modern day, for us to communicate with the distant laboratories, if you don't have an in-house laboratory, this method will be helping us to transfer the data in an express way, rather carrying out these models and bite blocks with the courier services and with other transportation methods. Okay, let's go and check our data collection. Now, this is the data collection that we got from our bite registration. You have the upper arch, all the implants, the implant bed, the gingival data, and the labial surface. Here, this labial surface, you can call it the labial surface or the outer surface of the cast, is properly recorded. And when we go for the lower arch, almost the outer surface of the cast is properly recorded. The clinician can decide. This is just the cast that we have gathered the data for us to make the lower arch. That you can see all the implants, abutments are being scanned, and then the surface data, surface details are being transferred into the computer with the help of intraoral scanner. What is this? This is the upper one. This is the lower. And this is the bite. Upper cast, the lower cast, and the bite. So you can see how the data is being used, because in this case the computer has collected the data from the articulator itself, where the relationship between the upper and lower cast, upper and lower jaws of the patient. And here, the most importantly, the scanner has captured the data of the occlusal plane and the midline and the high lip line and the canine lines. So you may realize how these parameters or the markings are important the time that you are designing your prosthesis in the computer. So you go ahead and process the data, and then you can start your steps.